The Federal Capital Territory, Lagos, Ogun, Sokoto, Kano and Kaduna states have been enrolled in the global solidarity trial of the vaccines being developed to tackle the coronavirus pandemic. The drug trial is spearheaded by the World Health Organization. Joining me via Skype is Gbenga Olubowale, a pharmacist and former chairman of Pharmaceutical Society of Nigeria. Good morning, and thank you for joining us on TVC Breakfast.
Yeah, good morning.
All right. Right. Now, Nigerians have been divergent in their views ever since the federal government made this known of being part of the WHO drug trial. Now, help us better understand how drug trials work.
Okay, thank you very much. Clinical trials of drugs, vaccines, and even medical materials are a norm which ideally the various regulatory agencies will normally try to use one to screen and to ensure that the new products, in this case vaccines or drugs, are safe for human usage. You know, I mean, this normally will happen after you've tested it with the animals, and then you now want to proceed to test with human being. It comes in phases. There are phase 1, phase 2, phase 3, and phase 4. During the phase 1, what you do essentially is that you look at a very small population, and then, that cut across ages and, cross sex too. That means you have both the male and the female, and then the old and the young. Then a small proportion of them. What you are trying to do essentially at this stage is that you want to know the accurate dosage that are essential for treatment, as the case may be, and at the same time, you want to be sure that any adverse reaction, these are the kind of reaction you are not expected or you don't really want. You want to study what are the impact. Number one, you'll be able to benchmark the correct dosage for human usage. So essentially, that's what is all this is all about. If the first phase is successful, then you move into the second phase, whereby you increase the sample, proportion.
That's where the concerns of Nigerians, a lot of Nigerians, seem to lie. If the conditionality of if it works, if it is successful, they seem to be worried about a lot of Nigerians or Africans being used as lab rats.
Well, unfortunately, I would not say that we are being used as lab rats or guinea pigs, as the case may be, because if you know the whole genesis of this, is about the solidarity, with WHO clinical trials. That's the whole essence. And it's not only Nigeria. There are other countries that have been also selected for this purpose. And then may I also remind you that in a period like this, where you have pandemics, it's like in a war zone, you use everything available. If you have a patient that is already critically ill, there's really nothing wrong in making such a patient available for testing, because it's like a 50-50 chances. The drug in question might actually work the miracle, if you give to the patient and the patient responded positively. But what if you don't give? The pandemic will still continue to ravage the environment, and then the outcome, of course, is what we all don't like, which is death. So it's really, there's nothing wrong in allowing a portion of the population to be used for this purpose. But again,
are you saying now that you are in support of this?
I think there's nothing wrong in the federal government move to at least allow Nigeria to be used for this purpose. It's not just about Nigeria, but my only concern is that there are various local, indigenous preparations that are also crying for clinical trials, and the government has done nothing practically to this. You understand what I'm saying? We would have been more happier if these clinical trials are done on our indigenous products, that a lot of scientists, pharmacists, scientists have actually come out to say, look, we have a cure or a palliative or something that we are sure can be used to manage these cases. You understand what I'm saying? So before even WHO came down to us, we would have done something on our own.
All right. Let's leave the conversation here now. Gbenga Olubowale, thank you so much for speaking with us.